testing and counseling, PrEP and APEP, we do here. So for our HIV program, but the health board does a lot more. We have TV services, refugee services, immunization, family health, family planning, environmental health, you need your septic tank tested, WIC, Healthy Start, and breast and cervical cancer screening and treatment. We don't treat here, but we hook you up with, programs that can help you. So we partner a lot with our, agencies throughout the county, and MACA is one of them. We will, work together. Like if they have someone that needs the breast and cervical cancer, they could refer them to us. Or if you come across somebody that needs WIC, or whatever, we can hook you up really easily. So you can call Rob, any of us. Are you gonna do introductions? I don't know. But Rob, you also all know Rob. He does our HIV linkage to care and kind of oversees the jail project. I forgot about that. Our jail testing and counseling and linkage. I have some new staff here. So Gertrude, Kelly, and Kimberly. So that we're, I said this is perfect time to have some information brought to them that's not on a screen. So I appreciate you all coming out, and hope you enjoy the day.
Thank you. This morning, I am Dr. Joseph. I feel like I'm a part of the family now with Miss Sylvia and Maca. As I was preparing for the presentation today, I was like, wait a minute now. I think this woman is taking this thing on the road. She is touring now. I have been partnered with Miss Sylvia and the Maca family in Tallahassee. Man, I feel like it's 2015, 2016. When I first, she was having the HIV awareness and conference in Tallahassee. And so when she called me, she's the only woman that can call me in less than 10 days and say, I need you. I know you're in Orlando, it's down the street, whatever it is, come out, I need you. And so that's why I'm here today. You probably hear the accent. I'm originally from the Bahamas, but I have been in Florida for a very long time. And I hail from the #1 HBCU in the country, Florida A&M University. Yes. So any radicals in the house? Yes. Sylvia back there like, yes. So I am excited about today, and today you're going to get a treat. Normally when we are having these conversations, and Maca is hosting these seminars throughout the nation, not just in the state of Florida, but even online as well, we normally just talk about PrEP and HIV. But today someone said, we're getting a sweet treat. Everyone repeat after me. We're getting a sweet treat.
We're getting a sweet treat.
Because in addition to talking about HIV, we're also going to talk about diabetes. So you are getting 2 for the price of 1. How many of you like discounts? Raise your hands. Yeah. All right, discount me. If I don't have to pay full price, please give me the discount. All right? Give me the code. So, and I want to again give a shout out to Pasco One. I see, like she said earlier, it's a new building. It is a beautiful building. So shout out to Pasco County, because again, our health departments, our communities, right? Our people, our children, our families, our senior citizens, they cannot survive and thrive without the health department. So let's give it a round of applause for Pasco Health Department. All right, so this month is particularly special because we know that this month is National Minority Health Month, right? And when we look at the different conditions and diseases, it mostly affects our minority population. And who is also underserved is our minority population. And so today, my agenda, as we go throughout the presentation, we don't just want you to walk away just being inspired and empowered by the information, but we want you in partnership with Maca and with the Pasco Health Department. We want you to take this information and spread it to the rest of the community, right? Your friends and your family. We're going to get a little touchy today because I'm one of those pharmacists that, we're not just going to get talk about the information, but I want you to also speak that back to me. So be a little churchy. So I may ask you to repeat some things. Are we all right with that? Yeah. All right. So let's get into it. So my agenda, my topics for today, as we said, how many of you, show of hands, you like to have a good time? Woo! Woo! both of my hands, right? Especially if it's on the beach. You give me some hot tea episodes of the Cosbys or Golden Girls. I am on the couch. Give me some good food, and I am out, right? So, but we want to have a good time minus HIV. My second agenda for today is we're going to learn about PrEP. We're going to talk about sex, baby, but we're also going to talk about PrEP as well, right? And then last but not least, we are going to talk about diabetes. How many of you know someone or know someone that has diabetes? Raise your hands. Right? That's pretty much the majority of the room. So we all know people who are affected and impacted by diabetes. But we also know that diabetes is curable, it is treatable, and it is also manageable with the resources here at the health department and also with MACA, all right? So if you are here, I want you to yell, I am here and I'm awake.
I'm here and I'm awake.
All right, perfect. So, HIV, we heard about it, right? Someone, is there a difference between HIV and AIDS? True or false? True. All right, great class. That means y'all were paying attention in school. So we're gonna get through this. So yes, there is a difference between HIV and AIDS, but unfortunately, there are many people in our communities that don't know that. People with all of the information, with Google, with AI, with all of the information that we have, there are people in our communities, minorities, who still believe that I can contract HIV by touching a doorknob.
Yeah.
Do y'all believe that?
No.
It's hard to believe that people still believe that.
Yeah.
That if you sit next to someone who is HIV positive, they still believe that they can contract HIV that way with all of the information. So just because you have all of the information, it doesn't mean that people are making the right decisions and choices. All right? How often do you take Truvada? Is it once a day, 3 times a day?
Once a day.
It's once a day. And the reason why that is important, because most people, when they are taking medications, you kind of pretty much compliance is an issue. So when manufacturers, they are making these medications and they're approving them, especially if there is a stigma attached to that drug or disease state, they try to figure out, okay, what can we do to ensure that each patient that receives this drug not only takes it on time, but takes it as prescribed. You make it once a day. And we're going to talk a little bit more about Truvada. Heart medications, right? Cholesterol pills and statins. Now, how many of you know someone, or maybe you are taking medications for your cholesterol levels, right? Raise your hands. The reason why I'm bringing that up is because when a patient or when an individual is diagnosed with HIV, what ends up happening is there are other comorbid conditions that come alongside. So they may not just have HIV. Over a period of time taking the medication, they may actually end up with high liver function levels. So now they have to be prescribed a cholesterol. We need to know what's happening in our body, right? I cannot just look at someone in a room or go to a party and say, oh, that person has HIV or that person has COVID. Can you just look at someone and tell that they are HIV or they have COVID? No, you cannot, right? There may be certain symptoms that you may think that can, will say, hey, this person is positive or negative, but you have to take a blood test. We need to encourage our loved ones, our family members, our peers and colleagues to make sure that they are getting tested. So especially if they're having unprotected sex. Let me say this, as we're looking there with unprotected sex, right? Anal and oral. Especially, how many of you are around younger people or you know a Gen Z or an someone in the alpha generation? Now, let me say this. As the elders in our community, I'm a millennial, and one thing I will say is we have to be vulnerable with the next generation. Because if we're not vulnerable and honest with them, they think that what is happening is all new. How many of you heard of the saying, there's nothing new under the sun? It's true. So they think that, we don't know what we're talking about. They think that they know about sex. They think they know what's going to happen after 6, 7 bottles of tequila and shots. They think they know that their best friend is only having sex with them and no one else. But again, it is our responsibility, if we're going to change and improve the statistics of our minority population, we have to start talking to our children, whether they like it or not. She just traveled back to Tallahassee. My younger cousin, she just got accepted into FAMU, and we were having conversations, and she is a Gen Z. And listen, we were talking about it. I'm very honest with her, and she was sharing with me how one of her roommates had chlamydia and she had no idea. She did not know what chlamydia was until she went and got tested. Is she sexually active? Yes. But this is what was a red flag. And I asked my cousin, I said, did you hear about chlamydia prior to that? And she was like, not really. I heard something on TikTok, but that's all I know. That was her response. I heard something or seen something on TikTok, and that's all that I know. And we know that everything on social media isn't always accurate. But what scared me was the fact that at 19 years old, this was her roommate's first time even hearing about chlamydia. And she's sexually active. So the fact that there isn't an awareness and where our loved ones are engaging in these activities, Houston, we have a problem. And we gotta fix it, right? So frequently consuming drugs, which clouds our judgment, right? Prophylaxis. One more time. PrEP stands for? Pre-exposure. Prophylaxis. And so we talked about it earlier. That's Truvada. That's exactly what Truvada looks like. If you open the bottle, if you see the bottle, the company is called Gilead, and it's a blue pill. I've had to dispense it many times. Prior to moving to Orlando, I worked in Miami at an HIV center. I'm also certified as an HIV tester and counselor. So I was very, very familiar with this medication. And again, as we see there, it's just one pill. And the reason why we need to know about Truvada is because if we have loved ones, if you know a neighbor, if you know someone who shares needles, they're very active.
Infections, STIs, for example, gonorrhea, chlamydia, syphilis, trichomoniasis, trichomoniasis,
which is also called what, everyone? Trick. Right? We talked about chlamydia. Again, we have college students. We have 25-year-olds having sex and don't know what chlamydia or trick is. I remember going to one of my first missions trip. I went to Haiti for Thanksgiving, for World AIDS Day with a friend of mine, and we were working alongside the AHF. How many of you have heard of AIDS Health Foundation? Raise your hands. So yeah, they were, prior to COVID, they were doing a lot of international things, activities and initiatives, and they're still doing them. And so I was given the opportunity to go, and I met Miss Sylvia. I tested, so we tested about 1,500 locals, and there was a 60-year-old woman who was tested positive for syphilis. She had no idea. And syphilis, as we know, can sometimes be dormant for a while in people. But she had no idea. She'd never heard of it. And so as we were educating her and the locals that we tested, the reason why I'm bringing that up is because sometimes we think people know. So we had to make sure that we got her some help. Right, Ms. Sylvia, you had a comment?
Yes.
We even asked them to have sex with a condom.
Wow.
Yeah. It is offensive. So this is why education is so important. So here it is, a 13-year-old who got two best friends pregnant. And so the one best friend was standing behind him and the other friend, and one was pregnant, 13 years old. You don't even know your body. You're just learning about your menstrual cycle at 13. So imagine like how I felt, but then again, our work is so necessary. Because we think because people are adults, or we think because we have social media, that our loved ones are educating themselves. They're educating themselves, but they're still engaging and not exercising wisdom. All right? Last one.
Follow up with the medical provider call MACA every 3 months for testing, pregnancy testing, counseling, and kidney function.
Yes. That is important. Give her a round of applause. She still got the eyes of a 21-year-old. She just got to come a little closer. So those are important. Kidney function, because with Truvada, and there are certain medications, and the reason why we say every 3 months over 90 days, because what happens is with a drug like Truvada, your kidney function begins to elevate and decrease. So if a patient is on Truvada, or you know a loved one, or you recommended Truvada, they need to follow up with those doctor's appointments. Also, true or false, is there a medication on the market if a mother becomes pregnant and is HIV positive? Is there a drug on the market that can prevent the transmission from mother to fetus? Yes, absolutely. I'm so glad everyone knows that. Because we have pregnant moms, right? Yes, Miss Sylvia?
Well, I'm sorry to say that in the capital, they're probably a little smarter down here. In the capital, if a lady's pregnant, they're gonna wanna do a C-section. However, the further south you go, they know if you're taking that med that you can deliver a baby.
Yes.
And the baby, you won't transmit to the baby.
Right.
We just had a mother to deliver the baby, is like 2 months old? Yes. Oh.
Really?
Yeah.
Wow.
Yeah, and she had to come down further south
To get the service.
because she didn't want to have a C-section.
Wow.
So not all information get where it gotta go.
Yeah.
Where it needs to go.
It sounds crazy to us, but it's happening, right? And especially with mothers, because then probably there's the shame, right? We won't get into all the politics around it about, abortion and things like that. But again, we need to make sure that our loved ones, prior to my mother being diagnosed with MS, prior to her death, she was first diagnosed with renal dysfunction. And so she was on dialysis for a very, very long time. So prior to being diagnosed with MS, we were up and down on dialysis, right? And how many of you know dialysis can be draining? Anyone know anybody that's on dialysis? It's every day. It is draining them, and it drains you as a caretaker. So that's another conversation as well that we need to have, because caretakers also not only need to know, but you have to take care of yourself as well. All right, so everyone repeat after me. I'm here to make changes.
I'm here to make changes.
So I can see changes.
So I can see changes.
One more time. I'm here to make changes.
I'm here to make changes.
So I can see changes.
So I can see changes.
All right, you all are doing great. We are now going to get a crash course on diabetes. No shame. I know, I've heard it when my patients call it like, I need the sugar diabetes medication, and my younger staff members, they're like, what is sugar diabetes? I'm like, her diabetic medication. Oh. So we have to educate them, because different, depending on the generation, depending on the culture, people refer to certain disease and conditions different. So as we can see there, how many types of diabetes are there? 1 or 2?
2.
All right. So type 1 diabetes is insulin dependent. Simply put, with someone who is diagnosed, they're pretty much born with it. Their cells, their beta cells are destroyed. And your beta cells are responsible for working with insulin and converting whatever you eat and drink and converting it into energy in the bloodstream. But for someone who has type 1, are they taking insulin or are they taking pills? Which one?
Insulin.
They're taking insulin, exactly. So they're never going to really convert, or it's not going to go from type 1 to type 2. Once you're type 1, unless God heals that person supernaturally, they're going to remain type 1. Now, type 2, what is type 2 diabetes called? Type 2 is diabetes mellitus. Is that one treatable?
Yes.
Yes. Type 2 diabetes is treatable, but our loved ones in the minority population, in our communities around the U.S., people believe once you're diagnosed with type 2 that you will always have to stay on the medication. That's not true. I have patients and I know people who started because, again, it's a lifestyle change. Even if you were, it runs in your family, maybe it's hereditary, you can still make lifestyle changes and not have to be on diabetes medication for the rest of your life. One of the risk factors, I think it's an oxymoron, but look at that, minorities.
Mm-hmm.
So even before they get their diagnosis, the risk factor is already counting against us in our community. Because again, we're minorities, most people are overweight, they have a really poor diet. No shame, but literally, I love eating rice. Leave it to me, I can eat rice every day. But my body doesn't want me to eat rice every day, so I have to work out. How many of you love eating rice? Like, it's a thing, it's a comfort food. But what happens is rice is converted into a carb, and carbohydrates is what? Sugar. Say it loud. Carbohydrates are what?
Sugar.
It's sugar. And for minorities, our bodies don't really like sugar like that. So we got to be careful. You can have your good foods, you can have the things that you love, but again, it's a risk factor for diabetes. All right, how many of you heard of metformin before? You know somebody on metformin? Right? And so those are the things that we have to help them with. Slow healing wounds. That loved one who's a diabetic, if they get a cut, if there is a blister on their feet, on their hand, anywhere on their body, you need to make sure that they're getting that treated. Because for some people, especially depending on the area, if it ends up on their hips, what can it turn into? A bed sore. It can turn into a boil, and staph infections, skin infections, they are treatable, but they are very hard to treat. And now our loved one is at risk for not only being hospitalized, but now they're at risk for other infections just from that wound, that blister that they keep treating themselves. And they're like, don't worry about it, I put some alcohol. Alcohol isn't going to do anything for a wound. But again, this is how minorities think. Or Vicks. She said Vicks. I haven't heard that one before. That's interesting. Or Vicks, right? Recurring infections. FYI, men do get UTIs. How many of you knew that? A lot of people, especially in the minority community, we believe that only women get UTIs. Men get urinary tract infections as well. It's just treated differently. All right, irritability and mood changes. You yell at the person at Publix, you go to Walmart, they took your spot. Now you're yelling every day, every time you go to Walmart, because they took your spot. Houston?
We have a problem.
We have a problem. All right, take a picture of this with your friends and your family members, even those who you think are healthy. Your blood sugar levels, right? If you are not a diabetic, the reason why we ask you to take a fasting glucose, because when you sleep anywhere from 8 to 12 hours, your number, when we test you, if you are fasting, to be not a diabetic, your number needs to be between what? 70 to 100 in a healthy individual. Now, if you know someone who is a diabetic, right, their number needs to be where?
80 and 130.
Between 80 and 130. Because again, your loved ones, they can get off diabetes medication. But if they're not taking the insulin, they only take it when they feel dizzy, they only take it when they feel like their sugar is high, that number isn't going to be between 80 and 130. All right? A1C. The A1C, simply put, is just an average of your sugar readings over a 3-month time. So what that's telling me as a pharmacist, your nurse, your nephrologist, or whoever your provider is, that's just telling us how your cells and your body and insulin is working. If you're pre-diabetic, it should be and pre-diabetes, let me say this. Let me park my car here. Pre-diabetes is on the rise in America. Now, I know everybody sounds the alarm with diabetes, but if you go and get your labs done at the beginning of the year or the end of the year, and your doctor's like, your numbers are okay, but you're borderline pre-diabetic, that means you need to make some changes, right? And this has nothing to do with sometimes just maybe people say, well, I'm not overweight, I'll just change. No, if you're pre-diabetic, you are close to being what? Diabetic. So we got to make some what?
Changes.
We got to make some changes. The way we eat, right? So this is a very important slide that I want you all to share with your loved ones. All right, we're almost done. Pre-diabetes, this is just wrapping up. What is the first bubble over here? What I need you to do, Entity, release your burdens, talk to partners. Unforgiveness, it is now, I've known this for years, but now medical providers, we are now talking to patients about the fact that they need to release their emotional burdens because it's impacting their health. How many of you know someone who had cancer, and how many of you know someone who has cancer or being treated for cancer or had cancer? Now, if you go, let's say, for example, prior to working at a mental health institution in Miami, there's a hospital called Joe DiMaggio. And one of the things that they have on their pediatric ward is they have dogs. They have dogs that go into the room at certain times of day to keep the patients, the pediatric patients and the children happy. Because when there's an increase in dopamine and serotonin, that expedites the healing process, right? The second tower, lifestyle changes. please, you don't need a prescription for a machine. Especially during COVID and the times that we are living in, don't wait to get a blood pressure monitor. If you are an adult, if you are of age, I see some of you can take a picture, please go to Walmart, go to Walgreens, get a blood pressure monitor. And especially if your loved one is a diabetic, they need to be testing frequently, right? Exercise, we talked about that. Sharing your family history. And then last but not least, HIV management. Keep hard candy. So if you have a loved one who's a diabetic, they should have what on them? Candy. Because it helps with what? Bring the sugar up. Because some people do experience, depending on what medication they are taking, some people actually experience the sugar level dropping really low, and they get dizzy and they get fatigued and they pass out. But if you have hard candy on hand, that can bring the sugar levels up immediately. We talked about the pharmacist. Again, if you are taking antibiotics, you should always complete the therapy, right? If you start one, if you have a side effects or if you have an allergy, call your pharmacist and let them know so we can make a note in your profile. But you never want to stop taking antibiotics midway, because then that makes you more susceptible for the recurrence of that infection. All right, practice self-talk. How many of you practice self-talk? Like you encourage yourself in the mirror, on your way to work, someone made you mad, your colleague stressing you out. Lord Jesus, if I get a text message. How many of you had those kind of coworkers? She said in the car. We gotta practice that, because again, that also contributes to us being stressed, because we're not talking to people. We're not confronting our